Welcome, everybody, to the Integrative Nutrition Seminar Series, and I have the great pleasure of being your host today. I'm accompanied by Nick Kummel as the EMCR champion, who's going to run all the questions at the end and make sure that anybody who hasn't signed the list at the back as a member for this seminar series early on in its career. Very distinguished series of speakers so far, and with Anne Marie today, we're continuing that building tradition. I'll begin by paying my respects on behalf of us all to the traditional owners of the lands on which we're meeting. We're here on Gadigal land. We pay our respects to the elders past, present and emerging. We have Anne Marie with us today. Now, Anne Marie Thow, Professor Anne Marie Thow, Professor of Public Policy and Health in what's now called the Leader Centre. I first heard of Anne Marie, I was just telling her, when I was very early on in 2012, the original days before we had a building at the Charles Perkins Centre. And I was at what was then called the Menzies Centre for Health Policy, led by Steve Leader. And he, in one of our meetings, was enthusing about this extraordinary PhD student he had who was commencing as a lecturer, and that was Anne Marie. So that's when I first heard of her. And in the years since, we've had a great honour in being able to see her develop in her career, rise to professorial level, and continuing her work where she's putting together nutrition, policy, economics, and putting it together within a global context. So looking at how nutrition policy could be developed to be more ethical, to be more equitable, to be more sustainable, and to be more effective. And along the way, she's become a real champion for the Charles Perkins Centre. She has been heavily involved in the food governance node, which began very early on in the centre's development. More recently, she and I have had the pleasure of starting up a new node on complex adaptive policy making with the Sydney Policy Lab. And she's been really crucial in the development of what became known as the Sydney Food and Nutrition Network, which became a nascent MDI and remains a nascent new MDI, and hopefully one day will become a real one. So Anne Marie is very well known to us. She's really significant in the life of the centre, and it's a great pleasure, therefore, to have her speak to us today. So Anne Marie, over to you.
Thank you so much for the warm welcome, Steve. And of course, I want to also echo the acknowledgement that we are meeting today on the unceded lands of the Gadigal people. And particularly in the context of food systems, I think it's always important to take a moment and be thankful in many ways for the rich traditions and wisdom that we're continuing to learn from our colleagues, the First Nations colleagues in Australia and elsewhere. I was really delighted to get the invitation to speak at this new nutrition seminar series. And today, what I want to talk about is how that broader context in which nutrition policy making is happening. I think it's really fundamentally quite an exciting time. Apologies, I lack the technological competency to make this align to actual years, but you can see in 1981, the World Health Organization and UNICEF created the International Code of Marketing of Breast Milk Substitutes. And then really there was a bit of a pause, 25 years of pause, and we had the global strategy on diet, physical activity and health. And for me, I think this kick-started 20 years of action on nutrition, which is really amazing when we think about nutrition policy from the global perspective. the Global Strategy on Diet, Physical Activity and Health was really talking, thank you so much, Nick, talking about what we now consider best practice measures in nutrition policy. Talked about fiscal policy, talked about labelling, talked about restricting marketing. It was very prescient and based on, anyway, and so really fantastic since then to see preliminary recommendations on restricting marketing, the Global Monitoring Framework on Maternal, Infant and Young Child Nutrition 2012. We also in 2014, I think I skipped it because it's not a formal recommendation, but the second International Conference on Nutrition happened in 2014, which was co-hosted by the World Health Organization and the FAO. This followed the first International Conference on Nutrition in 1992, which was also really fundamental in having these conversations about both addressing undernutrition as a global priority, but also recognizing this emerging burden of diet-related non-communicable diseases. But what I think we've seen since then is a real escalation. We had formal global nutrition targets put together by the World Health Organization in 2014. The UN General Assembly got on board and created the UN Decade of Action on Nutrition, which has now been extended to 2030. And then more recently even, we have the World Health Organization making formal guidelines, which have gone through their Guideline Development Review Committee and which constitute a real reference point for member states to make strong policies to address nutrition. So 2 of those have been released and there are 2 more that are in the works. So this is a really exciting time, particularly in terms of seeing action on nutrition being formally recommended and engaged on outside of the health sector. And in my own work, I also see that there's increasing recognition and action amongst those sectors that govern the food system who are now also taking on nutrition. As an example, the UN Tax Committee is about to release formal guidance on health taxes, including how to do fiscal policy well for nutrition, which is targeted to fiscal policy makers, not nutrition policy makers. And similarly, the World Trade Organization and the FAO at the end of last year both made strong statements about addressing trade and nutrition. The FAO in particular put in a couple of years to develop one of their biennial flagships totally devoted to trade and nutrition. So we're seeing a lot of recognition of the enormity of the problem and the need for action. But what we're also seeing is that we're not necessarily getting anywhere. We're seeing this, I guess, taking a long-term perspective for the last 30 years, quite significantly unhealthy changes in the food environment, particularly the rise in ultra-processed foods. But we're also seeing food production really suffer from climate change, that agricultural productivity is shifting really dramatically. And of course, countries are very differentially affected, but access to water, changing soil in particular are really impacting on production of healthy foods. In 2022, Russia invaded Ukraine. This is basically like the breadbasket of the world, and we suddenly saw a huge increase in food prices globally. This came on the tail of the COVID-19 epidemic, which substantially disrupted supply chains globally and also disrupted migration and a lot of those secondary factors which impact directly on food production and food access and food availability. So what we're dealing with now is, in fact, like the situation's starting to go backwards. With all of this attention to nutrition from, I think, really the post-war period, but really gaining a lot of traction in the early 90s, we actually did see improvements in nutritional status. And I think we saw some optimism in the mid-2010s around actually seeing some progress. We have had some progress in global stunting and wasting prevalence, some improvements in exclusive breastfeeding, but we're not seeing broad improvements. Micronutrient deficiencies, obesity's worsening, and fundamentally, we're really not seeing the progress we need to see to meet any of those global nutrition targets. And to me, this slide from the recent State of Food Insecurity SOFI report from the FAO plus friends. It's now like a 6 UN initiative, 6 UN member organisation initiative. What we see here is food insecurity and hunger. And you can see the reference point is 2015, where actually we had, when you read the SOFI in 2015, they're like, look at us, we're winning, we've done so well. And then almost immediately it flatlined. And then from 2019, it started to get worse. And then we saw, particularly for certain regions with the war in Ukraine, things exacerbated even further. What I find really interesting about this food crisis that we now are experiencing, and I think primarily we see issues around inflation and affordability of food, is that the food crisis is really seen from a policy perspective as an economic crisis. So I spent 6 months working for the Committee on World Food Security within the FAO in 2023, just as this was really starting to scale up. So in 2022, with the war in Ukraine, for the first time, the Committee on World Food Security couldn't finish their plenary meeting. So first time in 30, 40 years, they couldn't actually complete and make a statement at the end of the plenary because of the geopolitical tensions. It's quite challenging generally, interesting time to be working for the Secretariat. But what I really noticed is that when I looked at how this food crisis was being discussed at the global level, at the policy amongst the member states who were there talking about how to address the crisis, they were describing the crisis in terms around the impact on income and livelihoods, the impact on food systems, so supply chains, logistics. The impact on food price obviously was huge. And I think, you know, we all went to the grocery store thinking the same thing for a couple of years there. And also this issue of food access and availability. It felt quite frankly like we'd rewound to about 2005, where when we talked about food security, we just talked about any food. It didn't matter. Like there was no conversation about healthy food in that. And so what I also noticed is that the short-term responses, like, okay, we've got a crisis, we need to address it, what are we going to do? We're really focused very much on those economic drivers. And all this to say, I think these are absolutely critical things to address. Livelihood collapse is just a really bad thing and needs to be addressed. Like disruptions to global food systems and supply chains needs to be addressed. So I have no desire to undermine the importance of these. But what I felt was really missing in them was nutrition. So the recommendations that were coming out were to expand social protection, to reorient agricultural investment, particularly around maintaining productivity, to facilitate trade in food and to strengthen urban food systems. So all good things, but actually very little conversation about nutrition. And so when I was at the Committee on World Food Security, I kept hearing these conversations about the need to integrate long-term nutrition priorities into the short-term crisis response. And after a couple of months, I said to my colleague that it was my counterpart, I was like, do you know what they mean? Like what do they want, right? Like what would it look like to do that? And he was like, yeah, I don't know. So anyway, I'm sure there are people out there who did know, but I found this really interesting and I felt kind of embarrassed that I was also like, yes, we should do this, but I didn't actually know what I would be arguing for if one of my colleagues, particularly in trade where I do a lot of work, said to me, all right, great, yeah, integrate nutrition, but like, what do you mean? Like what actually would that look like? What would you like us to do here? Because we're willing to do it, but it's not our job, we don't do nutrition. So that led to this paper, which was published at the end of last year in the bulletin of the WHO. And really the rationale for this thinking, I think, is quite compelling. Partly that when we do make deliberate policy intervention into a food system, it has lasting changes. It partly, you know, as someone who studies politics through the lens of political science, one of my favourite policy scientists says that the best predictor of policy at time equals 1 is policy at time equals 0. Like largely what we see is incremental change. So if we're going to go in and make deliberate, substantial changes to food system policy, that's going to have impacts on subsequent policy decisions, because if there's not a crisis, it can be hard to make subsequent major changes, for example, to integrate nutrition. The other thing is that we have now really, I think, quite strong evidence for the substantial social and economic costs of poor nutrition. So that means, and you will notice that these short-term responses are largely economic policy sectors, and I mean, I'll get to the who later, but the people who are making these policies they have an economic mandate largely. They don't have a health and nutrition mandate. So as much as we might like to say to them, look, there's a huge opportunity while you're at it to also benefit nutrition, what we also need to help them to understand is that you're going to get much better outcomes socially and economically if you also invest in nutrition as well as health. And as I mentioned before, I think the other reason to be paying very close attention now is that periods of policy change do actually provide windows to rethink how we do policy and what that looks like. So what I want to talk about now is just to run through those sectors and talk a bit about what I think we might be asking for, but also why I think there's a really significant opportunity here for synergies and for mutual benefit across these sectors. So the first one I want to talk through is social protection. There's a lot of work that's been done on how you can design social protection policies to also improve nutrition. We know, for example, that cash transfers alone have fairly mixed impacts on nutrition. So if the government just gives you money, you may or may not, depending on many factors, spend that on healthier food rather than unhealthy food. But if you couple your social protection policies with nutrition education and information, if you also design them to preference healthy food, so the US has done this with their increasingly jeopardized SNAP, the Supplemental Nutrition Assistance Program, they've actually designed that program so you get an additional discount if you buy healthier food. So it's very possible to design your social protection policies in ways that do improve nutrition. And what I also noticed is that there is quite a strong agenda within the social protection policy space for priorities related to gender, related to local food systems in terms of fostering local economies. And also interest in thinking about traditional foods, I think in the broader context of decolonising approaches. And that was really exciting to see within that policy agenda, really obvious synergies where we could also look to improve nutrition. In terms of agricultural investment, what I see as the key opportunity here is shifting incentives within the agricultural policy space towards more nutritious foods, right? A lot of agricultural policy incentives related to food go to basically calorie production. So staple foods like rice and wheat, we also see a lot of corn and soy. Those are the main priorities for agricultural investment globally. But what we do also see is really incredible rethinking about repurposing agricultural investment. And my colleague Erica Reeve just led a paper on this, which will be coming out shortly. I think also in the bulletin. May it just come out? Anyway, on how we could integrate nutrition into the agricultural repurposing agenda. So if you're interested, highly recommend. But basically what we do see there is synergies with priorities, again, looking at exploring how we could better address traditional local foods, priorities for crop diversification and biodiversity, which have strong synergies with environmental policy objectives as well, but also have a benefit. Then there's literature on this showing that if you have more diverse agricultural production, we actually see that flow on to nutrition in a really immediate way. In terms of trade policy, the interest here is really just in generically facilitating trade. And I think what the opportunity is here is to introduce some preference for facilitating trade in nutritious foods. And this is partly why I'm so excited to see the work by the FAO Commodities Division and the World Trade Organization thinking about, well, what would that look like to actually shift policy? There's always room within any efforts towards trade liberalisation to preference certain types of foods. And this is where I think, in particular, creating spaces where the health sector and the trade sector can come together and have conversations about what types of food would we like to see preferenced or favoured. And this is particularly in relation to tariffs. So Fiji and Tonga, for example, both preferentially reduced their tariffs on healthy food imports to make it easier to import. But I think there's also some potential around how we create trade facilitation measures that make it easier to trade food across borders. I've got some incredible colleagues in the African region who are working on the African Continental Free Trade Agreement and have found that the foods that are most affected by current trade barriers in the region are healthy, minimally processed foods. So to be able to invest in trade facilitation with a focus on, say, fruit and vegetables and legumes would really change the affordability of food across the region and reduce wastage. Because if your ultra-processed food is stopped at the border, it's probably not really affected. If your fresh fruit and vegetables are stopped at the border, they very rapidly perish, right? So integrating these considerations into how we move forward and prioritise trade policy. The last is urban planning, and I was really excited. I'm sure you all saw the recent high-level panel of experts report on urban and peri-urban food systems. Also going to put in a plug that Jane Battersby, who led that report, will be here giving seminars in August. I'm going to be sending out an invite, but there's a lot of really exciting work on at the moment on thinking strategically about urban food systems as embedded within peri-urban, regional and remote food systems, and how we can rethink how urban food systems look and what it would look like to shift our urban planning approaches to enable access to nutritious food. I think there is a lot of attention, particularly with the massive disruption to trade that COVID and then the war in Ukraine generated. There's a huge opportunity at the moment to think about local food systems and to think about food security through the lens of fostering and enhancing local food systems. Also to say that, of course, this is not a separate conversation to agriculture and social protection policy, but it is a very separate policy sector. And so one of the other roles that I think we can play is as people who are interested in nutrition from a health perspective, is bringing together these stakeholders and being able to think strategically about what it would look like to get affordable, healthy food to people strategically. So, of course, the last thing I wanted to highlight here is the importance of governance and cross-sectoral leadership from the health sector. What I'm sure you noticed, or maybe it's just me as like a policy wonk, is that the health sector doesn't have any role in any of those policy sectors formally, right? So part of the challenge that we then have is how we can play what I would argue is a really pivotal leadership role, because those sectors also aren't really talking to each other, right? It's not just that health's excluded, it's that there's often not a room for those conversations to be happening. And also, as another related read, my colleague Dori Pate, who's here at the Uni of Sydney, has just led a paper which will come out on Friday in Nature Food on multi-sectoral governance mechanisms. And I wanted to give a shout out to that excellent work. So please watch your inboxes for that. But really what we often see is this systemic challenge of multi-sectoral coordination and collaboration on food systems. And we see the health sector as having almost no policy levers to do anything about food systems themselves, but also no remit to be in that room sometimes. And so what I would argue for here is that we want to see a careful thinking about how we talk about nutrition in these contexts, how we explain to these sectors who have completely different key performance indicators, completely different priorities, why this matters for them and how this does actually, you know, as I described with those different synergies, help them to achieve their policy objectives. We also need to be advocating for mechanisms that do enable this cross-sectoral conversation and collaboration. To think about and to advocate strongly for equity and transparency, which I think is really core to what we do as people who are interested in nutrition from a health perspective. And it just looks different in other sectors. And I think this is something valuable that we bring to the table. The other thing that I really think we bring to the table is explicit conversations about conflicts of interest and the influence of vested interests in policy making, which often don't happen, particularly in economic sectors where industry broadly is a primary stakeholder for policy making. And there's usually a lot of mechanisms which allow industry to speak directly into trade policy, agricultural policy, fiscal policy, where there's a lack of appreciation, I think, for what this means for policies in terms of then how strongly and how well they address issues of nutrition. And this is something critical that we can bring to the table. In line with this, I want to talk a little bit about power as part of leadership. I did a study as part of my time with the Committee on World Food Security. And my question was to ask people all over the world. So I had 43 respondents from global, regional, and then also national levels, so about 12 countries, where they had, what factors contributed to successful engagement between health and nutrition and the other policy sectors, right? And so what I was interested in, I think, was quite nerdy, you know, institutional agency dynamics around how policy gets made. What people talked about was that, so there's a couple of other papers on that, but this, I noticed that actually people talked a lot about these factors down the left-hand side, having a learning mindset, being persistent, being patient. Sometimes this took 10 years to get policy change through. To be humble, people described situations, they were like, well, it's really easy if you're working with people who don't have massive egos, and actually you can listen really well. Listening was a really significant thing. I think more than a quarter of my respondents explicitly talked about being a good listener, right? And it was interesting because I don't think any of this is rocket science, right? It's probably not that surprising. But when you look at the political science literature and even the nutrition policy literature, we don't always see these, what I was thinking of as like sort of personal characteristics come up. But the more that I sat with my data, the more I realized that actually what people were talking about is ways that they as individuals and teams were able to exert power in these policy processes. So I worked with a couple of my colleagues who are very good on theory and also used Azaveta's conception of power, not as power over, which of course happens, but he talks about power with, power to, and power despite, which I thought was a really helpful lens to look at leadership through, that actually what we want to see in food systems and in nutrition is not just people exerting power over and getting their own way, but actually working together to create coalitions and collective action that then fosters the kind of institutional change, but also overcomes those challenges that we see structurally. So I saw that people were able to build relationships with people, both multidisciplinary teams working in nutrition, anthropologists, media people, marketing people in their own teams, but also to reach out across policy sectors and build these relationships with their colleagues who were working for these broader shared objectives related to society and government as a whole. to shape ideas, how we think about what we're all trying to do collectively, and to then innovate, to us, to spend time sitting together, to listen and to learn, and to come up with new ways of addressing these policy challenges that were fit for purpose and context, which let them overcome the very, very concerted opposition, usually by industry in this context. So just to wrap up, as my last slide, I wanted to talk a bit about what does this mean for us as researchers. I feel like you've all been very patient as I've talked about my policy world, but I think there's also a really critical role, of course, that we as researchers can play in fostering this kind of policy change and action. One thing that has always struck me about how we think about evidence for action in nutrition policy is that we're very good often at generating evidence which health policymakers love and find very useful, and it's super important and we should keep doing it. But I think we also sometimes need to stretch ourselves and ask ourselves, okay, yes, but what do the people who are tasked with making social protection policy need to know here? Because actually they need to know different things. The people in trade policy need to know different things than the people in health policy, even about the same policy issue. I can give you a good example on tax, actually, because I've just spent 5 years with the UN Tax Committee on this handbook. And they are very appreciative of the health evidence. This is the primary rationale for action on health taxes. But what they really also need to know is, how was industry affected? Did employment go down? They want to know, like, were there inequalities, right? They're very keen to avoid any sort of regression from a tax perspective, differential impacts on the poor, basically. And so all of that slightly different evidence is really critical when we're talking about a policy that fundamentally requires collaboration. The second thing, which I already mentioned briefly, was this idea of innovative solutions. I mean, I think this broad framework that the World Health Organization and others have developed at the global level is really useful as guidance and as consolidating best practice. But when you take even a recognized best practice measure and adapt that and implement it to turn it into policy in a specific national or subnational context, that requires innovation. We have to think about, okay, but what does our context look like? What does our trade policy look like? How are our agricultural subsidies given? What would it look like to actually sit with the specifics, to try something a bit new? And this, I think, is where evidence can be absolutely critical. The other way that I think a focus on innovation can help is that often we see at the smaller scale, different governments try something new. And there's often a huge opportunity to scale that up. But we can only do that if we're paying attention as researchers and understanding how it worked, what it looked like, what impact it had, and for whom. So studying innovation, I think, is a really critical need. Similarly, and I guess this relates, monitoring and evaluation. So looking for ways to partner with government to conduct research, as I know many of you do, on real life interventions and policies to understand in more detail how they impact outcomes. But as I mentioned at the beginning as well, not just health outcomes, but more widely, how those impacts play out. And the last thing, of course, is this idea of leadership, to study how policy actors, but also these broader epistemic communities and coalitions can work together to foster the change that we really want to see. And a final I guess, plug is that I'm part of a group called the Next Generation Leadership Collective for Nourishing Food Systems. And so we're a group of women who are working on understanding better how we can do leadership differently and how leadership can foster collective action on food systems to change the unhelpful status quo. So I think more research attention to what leadership looks like and how we can foster change is really critical. Thank you so much.
Thanks so much for that, Anne Marie. Found it really inspirational how you wove together those different pillars of economics, social policy, and nutrition. And I'm just curious, from your experience, you kind of touched on this conflicts of interest aspect of it and industry and these major barriers in terms of getting policy through to the finish line. Have you, in your experience, seen anything that has helped or pushed them to the end of the line in terms of getting it over the industry barriers? Or do you have any case studies that have worked in your experience?
Thanks so much, Nick. It's a great question. Yes, and I think part of it is relational, and part because I genuinely think that, I mean, what I do see is a lot of goodwill towards nutrition amongst policy makers in other sectors, and I sometimes just think this is because we all eat, right? It's kind of an intimate policy area in that everybody has experience with trying to, have households that eat healthy food in, to different degrees. But often I think there are very strong paradigms that policymakers hold who are trained in the economic sector, and also very strong mandates around ensuring that they're making policy decisions that don't impact negatively on industry, right? As a means to economic growth. And what this creates is often this like a big blind spot. I mean, I'm sure I could say this less positively, but let's call it a big blind spot where they tend to just believe what industry says, right? So with soft drink taxes as an example, industry goes in very hard and says like this would decimate the economy. But there's no evidence that it will. Like they have certainly funded about 7 or 8 very strategic studies which make really wild claims. And South Africa is a great case in point because when they were fact-checked by academia and NGOs in South Africa, they found that they were wildly exaggerated. Like the assumptions that they made meant that at least they were unreasonable estimates. And so in that context of having cross-sectoral relationships, the academics and the Department of Health were able to present to Treasury the reasons why these estimates were inappropriate and why this was not going to happen. And they did get the tax over the line, and it was lower than they'd hoped, but it was subsequently increased. So I think that like evidence is really key, but also kind of making that reality visible, right? Like having a conversation about vested interests and actually drawing attention to the flaws. I mean, one more story is that my colleague from the UN Tax Committee rang me about halfway through the process and went, "Are you really sure this is not going to blow back really badly and the industry is going to be terribly affected?" And I was like, "We have over 100 taxes in place now. Like we would know. Industry would make sure that we all knew if they had any negative impacts at all." Like, and she, actually we just finalized the handbook and she was like, "That was really good when you said that." We wouldn't have kept going because they were at every single meeting of the tax committee broadly as observers being like, this is the problems. It's depressingly persistent, but I think it is also something where in the context of having the conversations, people it's about making it.
No, thanks for that answer. And I think it helps also steer us in the right direction as well in terms of where we can put our efforts and research as a CPC, what work we do. I think driving that evidence base forward, exactly what you said, finding those points of doubt per se that industry might be opening up the door for conversation and shutting those down so we can actually make meaningful change. And I like what you said there about incremental, just making one small change. I mean, once they see the evidence, we can sort of kick that domino down the road. Fantastic answer. So I'll just open up the crowd now for any other questions. One in the back there, yep.
Thanks, Anne Marie. Such an insightful presentation as always. I just had one question with all your expertise in trade policy and nutrition. What do you think is the most actionable, lowest hanging fruit thing that Australia could do as part of their food policy reform?
This is such a good question. I've been thinking about this lots, and I wish I had a really easy answer. But I mean, I think, to be frank, they could put better, like continue to put stronger health safeguards in trade agreements, which mean that our nutrition policy is less vulnerable. Like if you look at the 2022 National Obesity Strategy and National Preventive Health Strategy, they've actually flagged really significant, like they're re-looking at mandatory labelling, they're thinking about fiscal policy, they want to restrict marketing. All of these policies are best practice, have lots of evidence, and are contested usually behind closed doors on the basis of like using trade agreements. And I think having a more and post tobacco disputes, I think we're doing a bit better, but I think that's a significant opportunity to make some clearer statements about food policy. Thank you.
Thanks for that. I'll just open it up to Tim Gill, who's online. Tim, if you'd like to just pop off your mute if you have your question.
Yeah, cheers. Thanks, Nick. Thanks, Anne Marie. Always fabulous stuff. Towards the end of the presentation there, you gave a nice overview of the priority areas in terms of research and evidence that need to be brought together to provide convincing arguments for policy shifts. Now, of course, these come from across a whole range of different sectors and within different domains. So who do you think is best placed, or who should be bringing this all together? Is there, some sort of structure out there that does this, or is this something that, needs to be addressed?
Thanks, Tim. Do you mean like bringing together the research, or do you mean like bringing together the policymakers who need to have the conversations?
No, I mean bringing together all the different forms of research and suggested strategies into a coherent argument for change. Yeah.
I see a couple of opportunities. I think it does happen. For some, I think part of it is the national level. I spent a sabbatical working with a community of practice in South Africa in 2018, and it was really inspiring. I was just back last month, again, sitting with this. So they have policymakers, they have researchers from across multiple disciplines, and they also have like local, provincial and national governance players, right? And to me, I think this is going to be really critical, particularly at national level, for moving forward, because as you can see, if you're starting to talk about, for example, urban and peri-urban food systems and how we do better policy for a local food system, actually the national agricultural policy has huge impact on that. So having like a national focus, I think, lets us have those multi-jurisdictional conversations and brings together people who are researching at the very local level, within a city, within a township, in the South African context, with people who are looking at national policy directions. And so I think, to me, this kind of community of practice is really a huge opportunity. And I think we're kind of, we have a little bit of that in Australia, which is really brilliant to see. Like the Public Health Association did that Food Policy Day after the prevention conference in April, which to me was kind of resonant of that. But I also would say, I think the WHO is probably best placed to do it for nutrition. And I think they do a good job. It was interesting. So I was for 6 years, I sat on their nutrition policy guidance advisory group, which just, we did the 4 things and then that's done. So we'll see what happens next. But for every systematic review on the evidence that they commissioned, they also wrote a really extensive review on contextual factors. which I thought was a really constructive way to do it in terms of bringing together not just the largely quantitative evidence, but also bringing in more of that evidence about how policy change happens. And I actually think that model was really good. So.
Can I ask something off the back of Tim's though, in relation to that? Is that what you're talking about? If sorry, I know that in I just your question to me segue into something different. And I'm sorry, I'm going to read what I've written.
No, that's great.
As things. So I hear what you said there, but how do we shift policy from sort of short-term food affordability, nutrition measures to long-term policies? When it really is, for the way I see it, it's we need governments to change, to drive the change and to change those policies. And with industry players in the room, often doesn't go the way it should. How do we shift that policy when economic and political cycles are so short-term and the economic interests of industry actors, big pharma, big food companies is also short-term? How they can profit.
Yeah, and when all our supers invested in those industries,
yeah, so
we're all shareholders because of that.
We have a very short-sighted view there. Our political cycles, our parties are looking at what is in their term, not is what in future terms for society as a whole. How do you
when I did that study and talked to these people who had experience, this was kind of what I was trying to understand. And I think one thing that really stood out is also how long-term it is. Like I said, people were like, yeah, okay, like we had a great success and it took 10 years. And we were, so I think part of it is having people in it for the long haul. This idea of a community of practice where you maintain some institutional knowledge. I mean, it depends a lot on the government too, right? I think in a situation where people are being moved fairly rapidly between departments, which I think the Australian government is kind of going through a bit of a phase of this, where it's like, oh, well, you're just a public servant, so you did a great job over in infrastructure, so now I'm putting you in health. Nicely played, and I think there are benefits to that because you do get fresh eyes and this capacity to step back and go, let's think about a system. But you also then have challenges even with institutional memory. So I feel like I'm even just making your question worse. They're very real challenges.
And you say it's not science. We all know this because we're all here for our passions and knowledge.
Yeah, exactly. And I think so. I do think that there is. I think one of the opportunities that I guess people outside, one of the opportunities that exists is that governments have these whole of government overarching objectives, right? Which usually are pretty inspiring in terms of thinking about well, what's the society we'd like to have? And I think part of the challenge is that they, when you are, I spent 3 years in government before I shifted into academia. You're just working on your little individual project. And I do think there's an opportunity, and where we do see success, it's because of this taking a step back and going, all right, well, wait, you're doing this and I'm doing this. And if we worked together, we could actually achieve these bigger objectives, and sort of changing the focus and the paradigm. And as part of that, I think, having those conversations about conflicts of interest and making that visible, okay, so wait, and creating this more whole of government perspective on what each sector is trying to do. The silos are there for a reason. It's very hard to be an expert in everything. But I think, for example, that the Sustainable Development Goals at the UN, for all their flaws, did a brilliant job of articulating these shared objectives. We're not working against each other here. And even though I'm conscious that occasionally I'm naively optimistic, that is what I have seen create change. And to be able to also create spaces for learning, right? Where you did have success in, the countries that came up in this study were super interesting. I had one woman describing this incredible success she'd had working in Sierra Leone. And I was like, that is not the country I would have been like, hey, I will learn a lot from, and it was multi-sectoral nutrition policy. She was building capacity across multiple sectors and seeing change happen. And so I think also creating spaces where we can swap notes as well, which again, the WHO does to a certain degree. But often there's like a very elite aspect in terms of who gets to go and be part of those conversations. And I guess I also see fundamentally like a need for decolonisation in the way that we think about like who learns from who, because we still do see this predominance of evidence from the US, good policy from the European region, which is true, they do many things well, but actually there's a lot of really amazing stuff going on, which is largely invisible in the way that we sort of think about knowledge. So I'd like to see some fundamental like upending of how we even think about who holds knowledge and who should be able, who should speak into these changes. So yeah. An ongoing conversation, I think.
Hi, thank you for the presentation. How do you talk about nutrition to third world countries who are barely able to feed their people? How do you talk nutrition to them?
It's a really good question. I do a lot of work in what I would term the majority world, who are struggling with concurrently like these terrible rates of hunger and food insecurity, as well as an emerging non-communicable disease burden. And I think this is now pretty universal to have, multiple forms of malnutrition coexisting. And even in Australia, like we still face this. We have like worse statistics related to undernutrition in remote communities in Australia than many, what might be called developing countries. So I think one challenge that I see is that they're often considered really separate problems, right? Like you've got people who don't eat enough. I actually had like a senior policymaker in India say this to me. We have to sort out the people who don't eat enough food before we can talk about the people who eat too much food, which I would argue is just a really like a deep misunderstanding of that multiple burdens of malnutrition setup. I think one of the challenges that people often can get enough calories. Like it's actually now like a pretty it's mainly in conflict and severe situations of disruption that people cannot get enough calories. It definitely happens, but I think the bigger challenge is food insecurity and a lack of access to healthy food, right? So when you have a household, which many households are, where you have a coexisting burden of undernutrition among the children, like stunted kids under 5, and then young mothers who are overweight or obese, it's not because the mothers are eating food that they should be giving to the children, right? Like, I mean, this is clearly not what's happening. It's that there's starchy staples, like usually quite refined starchy staples. And if you're a kid under 5, that leads to stunting and undernutrition. And if you're a young mother, it leads to overweight, right? So I think it's also maybe interrogating and again, making more visible the nature of the problem, because I think what we see here is a lack of attention to nourishing food with a historical focus, which was pretty necessary on starchy staples, right? So the Green Revolution, going back to the 70s, I think we have actually seen reduction in prevalence of hunger and severe hunger. We just haven't seen improvements in nutrition, right? Like in terms of people having access to healthy food. Does that help? So I guess part of what I see the opportunity is to reconceptualize, like, what is the problem that we're trying to fix? What do people need? Rather than, because I do think there are quite fundamental differences in how people see the problem. And if you are focused on getting people enough food with just any food, then industry is like, oh yeah, we can do that. Here's our ultra processed ready to, the IUTF ready to use therapeutic foods, right? Like, yeah, let's just do that, which is for very small populations, absolutely critical. But at a whole of population level, this is exacerbating another problem. Yeah.
Do you think there are any sort of global governance mechanisms that are viable to rebalance that?
Tim, the question was, are there global governance mechanisms that are viable to rebalance the way we think about nutrition? I think it is changing. Like in the last 10 years, there's been much more conversation and recognition of multiple burdens of malnutrition. I think the Global Nutrition Report in 2016 was actually speaking of the importance of evidence. I mean, that report was like every country in the world pretty much has multiple forms of malnutrition coexisting, which was really helpful. And I think it is just taking some time to filter. I think there's a lot of legacies around how economists are trained and that they do just think about nutrition equals calories. I actually, if I could do anything, I'd probably change economic training. But I think some of the forums, particularly under like the UN Food Systems Summit, which is fundamentally flawed, has very strong industry influence, but is creating a forum for conversation and across multiple sectors of people who care about food. And I think in fairness, it's also probably helping the health people to realize that it's not just about health, like actually, like probably like, I wish I could, there's like at least a fifth of the world's population is dependent on the food system for their livelihoods, right? Like if you sort of, I'm trying, you know, but also those are the people who are most likely to be malnourished, right? And like the, you know, kind of making some of those non-health, I mean, you know, it's all health related, but like, you know, the care factor of other sectors also visible to health, where we can start to think about what does it look like to address all of these, yeah, big challenge, but that's, yeah.
Fantastic answer. With that, I'll just wrap it up. If everyone could just join me for a round of applause for our speaker and for our chair. Thanks so much for that. And I'll just make a few housekeeping items. So in the back, we have our sheet where you can write your email or name if you're not on the current email list for the TINS seminar series. And of course, we have following this a light lunch. So if anybody's free after that and would like to join us. Otherwise, thank you all so much for joining us today. And thank you again, really rich discussion that came out of today's session. So glad you all made it and hope to see you in the next one. Thanks so much.